All right. Welcome, everyone. I know folks are still coming in, probably coming from the HRSA call that just happened at 2 p.m. So thank you for joining us today. In this chat box, you can see that we shared a link to the slides for today. So you can go ahead and click on that link and you should be able to see the slides and follow along if you would like to. So thanks so much for joining us for the second webinar in the SDOH Academy's Breakthrough Series. Today, we're going to be talking about the importance of building and sustaining an inclusive workforce, and we're going to share some resources health centers can use to promote this work. The faculty today want to acknowledge that the SDOH Academy is supported by HRSA's Bureau of Primary Healthcare. All of the faculty members of the SDOH Academy are HRSA-funded national training and technical assistance partners who are charged by HRSA to provide training and technical assistance around a variety of topics to health centers across the country. And we want to introduce you to your speakers today. So today's presenters include faculty from the Association of Clinicians for the Underserved, the National LGBT Health Education Center, the National Nurse-Led Care Consortium, and the National Healthcare for the Homeless Council. I'm going to let each of my colleagues introduce themselves when it's their turn to speak, and we're all available in the chat to answer questions throughout the presentation today. So a few quick housekeeping notes. Everyone should be pretty familiar with Zoom. I'm actually going to go ahead and send, that's the slide link again for those who are just joining. This webinar will be recorded. The slides and recording will be shared on the SDOH Academy website within the next few days. In the chat, I have again just sort of shared that slide link so that you can follow along. And speaking of the chat, we would love you to interact with us and your peers during the webinar. So you can use the chat. You can also use the Q&A pod for your comments and questions. The chat and Q&A pods can be found at the bottom of your Zoom screen. We ask that you type your questions for the presenters in the Q&A pod, not the chat. So whenever you have a specific question for the presenters, use the Q&A pod so that we can keep track of those and answer them as we move through the webinar. Also, if you'd like to share or chat with comments with your fellow learners and participants, make sure in the chat, click all panelists and attendees in the drop-down menu there so that you can share your comments with everybody, not just the panelists, okay? So we understand, again, that we're in the Zoom world now, right? So no worries if you have interruptions or you need to take a break or there are furry friends joining you during the webinar. It's all good. And again, the recording will be available later if you happen to miss any of it. So for those of you who attended our first Breakthrough Series webinar last week, you heard about the impetus behind this series. As the SDOH Academy, we really wanted to cut through all the information that's out there about SDOH and really deliver what we thought were crucial resources for health centers. There is so much to sift through sometimes that it's hard to pick which ideas or strategies are going to be relevant for you and your staff. So hopefully this Breakthrough Series does just that. Breaks through the noise to deliver the resources that you need to enact change. So there are two more Breakthrough Series webinars after this one, and you can find the links to sign up for those, as well as the recording and slides from last week's on the website, the SDOH Academy website, which Lauren just put in the chat for everyone. We also want to let you know that the faculty will be staying on after the hour for an optional 30-minute office hour session. During office hours, we're going to be chatting with you and discussing your questions and concerns in a much more informal way. So hopefully you'll be able to join us for that. Please feel free to stay on to engage after the official presentation has ended. So today we're going to discuss the value of hiring and supporting a diverse workforce that represents members of the health center patient population and larger community. We're going to identify workforce development practices that are culturally responsive. And we're going to examine case examples of practices and policies that include diverse perspectives and experiences in their workforce. So with this, let's go ahead and launch our first poll. Virginia, if you don't mind giving our first poll a go here. If you can't launch it, let me know and I'll just launch it too. But we want to start, great, perfect. With our first poll here. And we're asking, who is administering SDOH screening at your health center? Now, I realize that this question may be difficult to answer now because of COVID, but let's just think back to typically who is doing that SDOH screening. And we're going to give folks about 10 or so more seconds to fill that out. And then we will end and share the results. And then if you said other in this poll, please share in the chat, case managers. Okay, thanks so much for sharing in the chat. Great. And make sure you're putting all panelists and attendees there so we can all share together too. Perfect. Thank you for sharing. So we have some folks saying navigators, outreach, CHWs, care coordinators, case managers in the chat as well. Okay, awesome. Virginia, you can go ahead and close and share those results just so we can all see those. All right. So actually the majority is other. So not included in this list, which is really interesting. Then we have, looks like a lot of MAs, and then some folks who don't have anyone currently screening folks. So that's really, really interesting. Okay, thank you all for doing that poll with us. So thanks for sharing. We asked this question because one of the outcomes we want to promote from this series is to increase or enhance SDOH screening at your health center. And workforce is a crucial component of effective screening, since we know that patients may feel more comfortable sharing screening answers with staff who share their lived experiences. And having a screening tool in place is only helpful if patients provide us the information we need. And by creating a workforce that reflects our patients' characteristics, we can hopefully increase that trust and optimize the data we're collecting. And if you're interested in, if you're not really using a tool yet, or you're not sure which tool you might want to optimize, last week's webinar did a really deep dive into screening tools, and I would encourage you to check out the slides and recording from that. So during the Breakthrough series, we're highlighting 4 SDOH competencies that we think are important for all health center staff to be trained in. Today's focus is fostering a healthcare workforce able to address current and emerging needs related to SDOH. This competency emphasizes the importance of centering our workforce around team-based care, and it also details some of the topics that are helpful to incorporate into staff capacity building, such as cultural appropriateness, trauma-informed care, and empathic inquiry. It also encourages staff to be trained in sensitive and effective communication related to data collection around sexual orientation and gender identity, and that staff receive the resources they need to effectively respond to the complex SDOH faced by our patients. So we've discussed some of the cause, we've discussed this, we might already know why this competency is important, rather. And on this slide, we've actually shared some additional reasons. HRSA specifically mentions workforce training in SDOH in its strategic plan. Particularly, it talks about members of the workforce from rural and underserved communities. And this isn't only meant for clinicians, right? All health center staff members, from front desk to MAs, primary care providers, behavioral health, and so on, should really be able to address SDOH and emergency and emerging healthcare needs, and have access to ongoing training if needed. And we also know that the evidence supports training our workforce in SDOH competencies, as well as hiring and sustaining members of our team that reflect the lived experiences of our patients. Studies show that patient outcomes, as well as staff satisfaction, are improved when diversity is prioritized and valued. And as we discussed during our first poll, patients may be more willing to share SDOH information with members of the healthcare team that share some of their lived experiences, and those staff members who have expertise and knowledge to link patients to critical resources. Finally, all staff, whether or not they themselves have lived experiences, should be encouraged to grow and learn so that they can build trust with one another and their patients. So this brings us to our second poll. How equipped is your health center workforce to address SDOH? So just how do you, from your own perspective, how do you feel, how equipped do you feel your workforce is? And we'll give everybody a few moments to answer this poll. And again, I encourage you to use the chat to elaborate on your answer, ask clarifying questions. But if you feel like you want to share why you picked this answer, we would love to see that in the chat as well. We'll give everyone a moment. All right, Virginia, I think we can share our results. All right. So, pardon me. The results said somewhat equipped. We have a chat from Kim saying our office is not very diverse. So that's very interesting. Thank you. For those of you who did, though, express that your health center has room to grow, so folks who said that your health center was either not very equipped, somewhat equipped, what would help your health center workforce feel better equipped? What would help you feel like you could answer that question differently? And feel free to share that in the chat. Yeah, and so Linda in the Q&A pod shared help with translating their screening findings to EHR. Not all staff are authorized to enter data. So making sure that all staff have the capability to contribute to the SDOH data collection, sharing. Yes, thanks, Lauren. So what would help you feel more supported? So we have staff funding for sure. More staff working with follow-ups on the referrals. Yeah, absolutely. Great. So continue to share those, and we're curious to see if some of the strategies that we share today will kind of address some of those concerns or issues that you are having that hopefully you can kind of use to potentially feel a little bit more equipped or have that support for your staff. Yes, if staff could relate SDOH to their own life and struggles. That's a great answer. Thanks, Mary. So the faculty for this webinar has come up with 4 strategies for your health center to follow in building up your workforce capacity around SDOH. We list out some of the common challenges that you may face in implementing each of these strategies, but we're also going to provide some ideas and solutions to consider. And the first strategy includes increasing cultural responsiveness by promoting workforce diversity and inclusion. And we chose the term cultural responsiveness instead of cultural competence, not because cultural competence isn't important, but because cultural responsiveness kind of accounts for the fact that we may never be truly competent in someone else's culture or lived experience. Instead, providers and staff have to be committed to a lifetime of humble learning and exploration, right? That respects our patients' cultures and how culture affects healthcare and behavior. And in this strategy, we also emphasize the importance of diversity, right? We know that patients receive better care when members of their care team share their background in some way, whether that's race and ethnicity, cultural background, sexual or gender identity, or other factors that really form the foundation of our lived experience. So how can we expand the workforce pipeline to promote inclusion of individuals that share our patients' backgrounds? Furthermore, for those health center staff who may not share similar experiences to our patients, how do we encourage cultural responsiveness so that the entire team feels equipped to refer patients to resources? So as I go through these challenges, feel free to share additional ones in the chat or note whether one of these on the screen particularly resonates with you. One of the biggest challenges health centers face in creating and sustaining a diverse workforce is that individuals who share similar backgrounds as our patients face similar barriers to resources and opportunities, including education and other opportunities to enter healthcare. And we know that not all health centers are located near large urban centers with medical and nursing schools, and that staffing shortages are already a reality for many rural locations, for example. And then we move on to challenges that may exist in our health center culture. Cultural responsiveness and humility are often listed as priorities, but those priorities might not trickle down to the day-to-day health center operations. So there might not be processes in place to assess either staff diversity or cultural humility and responsiveness. We also know that just because we hire diverse staff, our health center may still struggle with fully accepting and supporting those individuals. So what are the solutions? The faculty on this webinar will talk about incorporating community health workers into your staff. Many of you already support CHWs. I know I saw in the chat earlier, someone shouted out CHWs there. They are a great resource to inform your entire health center about the challenges faced by the communities they come from, which are often the same communities as your patients. And on the last slide, I talked about how formal priorities or procedures don't always trickle down to the health center culture, but it's still critically important to have formal plans to hire diverse staff, and to update those regularly by examining the current state of your health center's diversity. Also, it can be hard to admit that we are uncomfortable or don't know the answer to something. And the only way to truly become culturally responsive is to admit that we don't have all the answers and that we're all learning. And building that level of trust among your staff is a necessary step to learn what additional training is needed. Your staff should feel comfortable raising concerns with leadership and suggesting new ways to improve diversity and cultural responsiveness. Our next strategy is to create a workforce that is supportive and inclusive of people who have lived experience. This calls back to our discussion of cultural responsiveness earlier. As we explore this strategy, we want to ask ourselves, how can we evolve our organizations to integrate new ideas and perspectives rather than expect people to assimilate to an existing dominant culture? So we've outlined some potential challenges to adopting this strategy. It's not enough to say that we are a culturally responsible organization and that we value the lived experiences of our patients. We have to demonstrate this strategy by purposefully including the perspectives of all patients and staff, including those whose experiences may differ from those of the dominant culture. And it's also worth mentioning that people with lived experiences may need accommodations to both work and receive care in the health center. This might include providing transportation for some staff or providing services in languages other than English. Many of you already have systems in place to support your patients and staff, but other times it may be challenging to provide all the necessary accommodations without additional support. So we've suggested some solutions that may help ensure that this strategy is fully implemented at your health center. If possible, examine the pay scale structure at your health center to reflect the added value that lived experience brings to your patients. As you look at pay scales, look at your onboarding process to make sure that all staff are meaningfully integrated. On the previous slide, we talked about accommodations for individuals with lived experience. This piece could be supported by partner organizations who may already play a significant role in your community. This could include churches, neighborhood associations, housing organizations, or other social service organizations. And finally, one of the best ways we can bolster an inclusive culture is to celebrate and honor diversity as a valued part of the organization. Great. And Evelyn in the chat just shared, organizations need to hire a diverse population and provide equitable pay and incentives. I couldn't have said it better. That was a perfect summary of that, Evelyn. Thank you so much for sharing. So strategy 3 discusses how to sustain a diverse workforce, right? Health centers can serve as a significant source of employment for their communities. Many people from low-income communities may lack formal education and may start in positions that don't require college degrees. Health centers have an opportunity to provide professional development and training so that those community members can grow in their organization and take on leadership roles. But of course, we have limited resources, both in terms of funding and in terms of staff time. Both are needed to make sure that professional development opportunities are available. Furthermore, leaders and supervisors who need to help plan or participate in professional development may be stretched thin, especially now as we continue to respond to the COVID-19 pandemic. So we do have some ideas and solutions, and I'm eager to see if you all can share additional ones in the chat. First, we can pursue funding opportunities specifically geared towards supporting staff with lived experience. There may be an opportunity to partner with another community organization like a housing authority or local college to pursue funding to support community members. I know of an organization or a funding opportunity in Philadelphia recently with a housing authority. The housing authority and the health center went in together to hire residents as peer navigators and to train them up to be CHWs. That's a perfect example of a funding opportunity. The problem then comes in how to sustain after that opportunity has ended. And certainly we can share some strategies about sustainability on that front as well. For leaders and supervisors, build professional development into job descriptions so that it's an expected and respected part of their workload. Leaders should be given time during work hours to support staff and provide mentoring. Speaking of which, think about continuous learning for the whole team to develop leadership skills like mentoring and coaching. Finally, our fourth strategy is to formalize this work by engaging leadership and board members and by developing written policies that are updated regularly to reflect a continuous cycle of improvement and reflection. If health center leaders aren't brought in to the strategies that we've talked about, it's extremely difficult to move the needle on any one of these ideas. Written policies can help make sure that the entire organization is aware of the importance of diversity and is on the same page about prioritizing cultural responsiveness. And there are challenges with this that really go back to the idea of creating a transparent, trusting culture. If policies are kept on a shelf and never changed or rethought, staff may be unaware of the priorities that leadership has, and what's written as the organizational's guiding principles might not actually reflect the culture at the health center. And we also know that it's challenging to make sure that the board is a part of the larger health center culture at times. As decision makers for the organization, it's critical that board members be fully equipped to advocate for the health center and its staff to make sure that people with lived experiences are welcome and valued. The third challenge I've listed here is something that I've seen at organizations I've been at in the past. At times I've thought to myself, if leadership really knew how it was to do this work on a day-to-day basis, they would have made a completely different decision, or they would not have made that decision. I think personally, the health centers really excel in this area. I think so many of our leaders are also providers and also have experience and work hand in hand across interdisciplinary teams and truly understand the needs of frontline staff. So we just want to ensure that is the case and that continues to happen. We want to make sure that priorities are set not only to meet the bottom line, but to support all levels of staff. So our team discussed the importance of optimizing the patient role on your board. Patients can offer great insights about your health center's hiring practices and can also share the community resources that are most useful and respected among your population. If your health center is doing strategic planning, consider including front desk staff, MAs, or other roles in the process to make sure that their perspective is heard. Highlight what the written policies are and where to find them so that everybody can point to shared resources and use common language. And then finally, think about asking your leadership whether someone might want to serve as the health center culture champion. This might be someone who is dedicated to making sure that diversity and cultural responsiveness are at the center of the health center's workforce operations, whether that's making sure new staff are welcomed and integrated, or maybe even staffing a table at a local career fair. So some sort of simple tasks that a clinician or another leader can really advocate for. Here are just three references that you can kind of look at. One is the HRSA strategic plan, and then two are some articles and studies that kind of support this idea of how workforce diversity is really a driver of patient improved patient outcomes and workforce satisfaction. So now that we've sort of laid the groundwork for all of that with some strategies and ideas, we want to provide some go-to resources and tools for you to really do this work. And even if you're already doing a great job and feel like you're very well equipped, maybe even adding on and enhancing some of that work. So we're going to begin with one resource that we want to highlight for you, which is Integrating Community Health Workers into Primary Care Practice, a resource guide for healthcare for the homeless programs. And I'm going to welcome my colleague, Darlene, on to talk about this. Darlene, you're
great.
Good to go.
Thank you so much, Emily. I appreciate the introduction. I'm Darlene Jenkins, and I'm Senior Director of Programs at the National Healthcare for the Homeless Council. And this afternoon, we're going to share a resource guide that was actually developed as a result of an initiative we did with the Centers for Medicaid and Medicare, their innovation project. We received an innovation award from CMS, and we actually worked with 12 healthcare for the homeless health centers in 8 states to integrate people with the lived experience of homelessness as community health workers, where they were trained to connect people who were high users of the emergency department to primary care. And so this was a very successful project. And as a result of this project, we developed this guide to share some of the promising practices regarding what came out of the project. Community health workers would just basically share with you the importance of this. The American Public Health Association gave a real good definition of how we should view community health workers. They're actually the front line of public health workers. They're trusted members of the community, and they work very closely. What we like to say is they really have the street credit that is needed to connect with individuals in the community. And so next slide, please. I'm going to share now my screen in which I'm going to show the tool that we developed from the, let's see, let me find it. Here we go. Okay. The tool that was developed. Here we go. Okay. There. So this is the tool that was developed. It is an online, somewhat of a course or toolkit. It has different modules. Actually, there are 6 modules, as you can see here at the front. The first module talks about CHWs and HCH, and that is, I'm going to try to click on here and try to show the part of the different resources. At the first part, it just gives kind of an introduction, and it talks about the project in which we, as I just mentioned, it was a 3-year pilot where we integrated community health workers into health care for the homeless, and they connected high users. And this is kind of tells about the, I guess, the impetus or the results of why we did this. We also integrated within this resource the community health workers' voices. We thought it was very, very important that those who are engaging in this guide hear not only from the community health workers themselves, but also from the supervisors who were there to support this work within the 12 Health Care for the Homeless website. So that's module 1. Module 2 goes into the roles and responsibilities of the community health workers. And this, again, gives you kind of a overall view by the having the narrative, but then it goes into how community health workers' roles can be able to connect vulnerable populations or marginalized populations to the healthcare systems. They assist with the coordination and care transition of clients between the different health systems. They can also help with the enrollment programs and benefits. They are also helping with exercising cultural humility to make sure that the services that are being offered and that clients receive are appropriate. They also are able to really address some of the larger health issues. As Emily mentioned before, we know that many times people share information based on the trusted relationship they may have with the individual, and what they may share with their healthcare provider may not be the same that they will share with a community health worker because they feel a closer relationship. And so it is good to recognize that community health workers can be that trusted resource. And if we integrate the community health worker and bring their voice to the table, they are able to share things on a client perspective that many times a healthcare provider may not, excuse me, be able to share. So that is actually section 2 of this module. Section 3, I should say, of this tool. Section 3 actually talks about hiring the CHW, finding the right person. Now, this can be very kind of challenging. When we think of right person, we have to think about just who we think, what we identify as the right person, right? Because many times our definition of who the right person is can many times be based on our own experience or our own expectations. But when we're looking for someone with a lived experience, and in this case, a lived experience of homelessness, we were looking for people who were open and willing to learn the skill sets. They may not have the skills at that present time, but if they were open and willing and able to voice or share that they were open to learning the skills, they had a lot of energy, they had a sense of humor. These are the type of skill sets that we were looking for, more than just having perhaps that knowledge base or the learned background. Recruiting CHWs are also listed here, and also sample interview questions are given in this section of the toolkit. So it is really trying to help you think through the recruiting and hiring process of a community health worker, especially those who have a lived experience of homelessness. The next section is actually looking at training the CHW. This has some core competencies regarding when dealing with people experiencing homelessness, how the community health worker can address some of those issues that they may come in contact with. So it's looking at substance misuse and addiction, also mental health challenges, the importance of really coming from a trauma-informed lens. So there's some information here on training or providing that skill with what is trauma and how to become more trauma-informed. Also dealing with traumatic brain injury and cognitive impairment. We know many times individuals experiencing homelessness or even marginalized populations have some cognitive impairment just due to some of the situations that they have lived in or some of the diagnoses or chronic diseases that they may have. That brings us to the next core or the actual curriculum that's here, dealing with the different chronic diseases, also harm reduction, confidentiality, and also cultural humility. And then finally, we included some basic medical terminology to know that will be helpful for a community health worker when they're engaging within people experiencing homelessness. The next section is section 5. It's the supervision of community health workers. And I think this is the most important section. As Emily mentioned before, it really is not, it's important to finding the right person, but it really is also being transparent in, is your organization really ready to support someone with a lived experience, be it homelessness or substance misuse or mental health challenges or being a refugee or immigrant to our country? Is the organization really ready to not only provide the support, supervision, but also to integrate and to embrace this person into the culture of the organization? It's important to realize that this person is coming in and pretty much everyone knows their history, because if you come in, you're looking for someone with a lived experience, say of homelessness. Okay, everyone knows that this person has a lived experience of homelessness. And so unlike some staff, many of us, unless we disclose, may not share that we have had these different situations or experiences. But if you're actually recruiting and hiring a person with this lived experience, pretty much everyone knows that this person has that experience. And so it's very, very important that their experience does not become their identity at the organization. They should not be pointed out as, oh yes, they have the lived experience, and that becomes, oh, this is our person with the lived experience of homelessness, where you're introducing or you're thinking all the time about their experience, and that becomes their identity. So recognizing that their lived experience is their expertise, and just like everyone else that brings this expertise and skills to the table, they are bringing this expertise, a resiliency and survival to the table that they can share. And this is their strength, and they should be recognized and identified as this expert and this strength. There are also tips here regarding supervising and supporting. It's important that you're not just providing, having someone to supervise, especially someone with a lived experience of homelessness. They're not just, we have found that the most successful supervisor are those who have the empathy, as well as are not, it's not just an addition to an already full plate. That is really a planned out supervising situation where the person is actually also trained to be a supervisor of those with a lived experience. That has been the most successful. And so you'll see here some tools for supervisors that we have included, and some things to think about when you're trying to supervise a person with a lived experience. And then finally, the sixth section within this tool is actually looking at truly integrating the person into the care team. What does that look like? How does that feel? And building a supportive health care for the homeless environment in this case, or building a supportive environment for that person on your team, establishing a peer support for community health workers, and also here are some support resources. So hopefully you will take the time. I know I kind of just ran through this tool very quickly, but hopefully you will take the time to visit our website, nhchc.org, to look at the tool. If you have any further information or have questions, please do not hesitate to contact us. And my email is in the last slide, and I'll be happy to answer any questions that you may have. So now I'm going to turn it over to our next speaker. I think it's Mason, who is on for the next tool that they're sharing. And I will stop sharing my screen.
We're good. Awesome.
Great. Thank you.
Thank you so much, Darlene. And I'm going to similarly walk through some of the pieces around proficiency in clinical providers, but from a LGBTQIA+ lens. So I'm going to start with the topic of recruitment. Hit next slide. So I'm just going to outline some of the ideas, and all of these are laid out in a resource that we have available on our website and is included in these slides later on, the link to that. But starting with recruitment, thinking about the language that you use in the recruitment to attract LGBTQIA+ folks. So adding language of seeking LGBTQIA+ competency, having an equal opportunity employment statement is really important. And then you can use statements like LGBTQIA+ people are encouraged to apply. All of that language can be really important to attract and to bring in LGBTQIA+ identified individuals to apply. Also thinking beyond just the advertisement, where are you posting this? Where is this resource, or where is this job opportunity going to be available? There are a number of LGBTQIA+ networks like Out Professionals. There are also listservs and organizations for specific geographic or practice areas. So for instance, there are LGBTQIA+ social worker organizations, nurse organizations, therapy, listservs, all of those types of things. Hey, even if you're posting this on social media, there are sometimes what we call the queer exchange groups on, say, Facebook, where you can find a lot of job opportunity, folks who are interested in job, and also posts about job openings. There are LGBTQIA+ career fairs that you can look in your area for. There are also a number of LGBT, LGBTQ, or beyond Chamber of Commerce. There's a national Chamber of Commerce. There's also regional ones that oftentimes have a job board where you can post jobs. So really looking for those spaces where LGBTQIA+ folks might be looking to find a position could be great. Awesome, thank you. Next is hiring. Just some things to note, particularly from an LGBTQIA+ perspective or standpoint. One is to keep in mind that name changes for some applicants may be a potential barrier or concern. If somebody who is trans or gender diverse is applying for a job, they may have had their last job or their job 5 years ago under a different name or pronouns. That might be a concern. So think about how you handle that, whether it's making space for pronouns on your application, having a conversation about that, or opening up that possibility or conversation may be something that you want to consider. In an interview, if you're looking for a specific area of expertise, ask about those. It's really important to note that being LGBTQIA+ competent may be very different from individual to individual, and that could be very different based just in comparison to saying, do you have experience in serving the healthcare needs of transgender or gender diverse patients, clients, etc. So prompting and asking about how what experience an individual has in caring for LGBTQIA+ needs, particularly in healthcare settings. Moving on to, there we go, onboarding. So a person has applied, they've been recruited, they went through the interview process, and now they're hired. How do we onboard and make sure that our onboarding process is inclusive for LGBTQIA+ folks? First of all, to make sure that inclusion and non-discrimination are part of all of the training materials. both thinking about terms and concepts, thinking about health disparities, communicating with cultural humility, which can include things like asking about names and pronouns, are really important. Preventing and addressing implicit bias. If you have some kind of onboarding training that has, all of the basics of, bringing somebody into your workforce, here are our mission and our goals and the ways that we expect people to act in this space, making sure that that is inclusive of gender identity and sexual orientation. Here's a big question that comes up a lot, and I'm almost guarantee you a trans or gender diverse individual will ask about this at some point, not all the time, but it can be a really big point for folks in this community, is does your insurance cover have considerations for LGBTQI+ needs, but thinking specifically around trans and gender diverse needs in relation to insurance coverage? If that's not something you have right now, it's something to explore, and that will attract a lot more LGBTQIA+ folks, but also thinking specifically around trans and gender diverse healthcare needs. Moving on to retention. Do you have non-discrimination policies that include name and pronouns and adherence to names and pronouns, even when that name or pronoun may be quote unquote inconsistent with a legal name or what name is made out on a check or in your employee database? So thinking about your personnel records and how we recognize both a common use name and a legal name, if there is a difference there, and making sure that that is something that everybody is aware of or adhering to. Universal dress codes that are not gendered. Hey, this one was just in the news, and I can say this as a former Disneyland cast member. Disney just made this a reality, so we can too. But making sure that dress codes are not gendered, and that there is really the opportunity for everybody to express themselves and not feel limited based on a dress code that may push their gender identity into question or their gender expression as well. Guidelines to support administrative handling and communication for gender affirmation. If somebody comes out as trans or gender diverse in the workplace, does the team know what next steps are best and how to have those conversations with that individual? Having that in place, having a policy in place can be really important for trans and gender diverse individuals. Are there mentorship opportunities? Are there opportunities for LGBTQI+ folks to grow, to have professional development that is responsive to the individual needs and the unique needs of LGBTQIA+ folks? And similarly, having an employee resource group that addresses the needs of this community. All of these things can be really important to making sure that a space is LGBTQIA+ inclusive, responsive, and friendly. And that will, of course, as we know and as we've already discussed, that will ensure that LGBTQIA+ individuals who are seeking care, who are coming to you for care, can see themselves reflected in the staff and the folks who are serving their needs. So that's a little bit from us at the National Center for LGBTQIA Health Education. So moving on to resource 3.
Thank you, Mason. Hi, my name is Sabrina Edgington. I am the Director of Learning and Curriculum Design at the Association of Clinicians for the Underserved. I'll be talking a little bit about racial and ethnic diversity at your organization. We developed in collaboration with the National Healthcare for the Homeless Council and the Association of Asian Pacific Community Health Organizations, this toolkit that we think is really helpful for organizations that are really trying to step up their game when they're trying to be more inclusive. And to Linda's point, if you've been looking at the Q&A, we didn't call it building a diverse organization, we called it building an inclusive organization, and that was very intentional. Can you go to the next slide, Emily? Great, so this toolkit answers some questions that came out of a learning collaborative that we did last year. And the learning collaborative was called Building an Inclusive Organization, but there were some big questions that came from the health centers that participated. Primarily, how can I use data to assess needs, implement action, and ensure accountability? What are the best practices in implementing policies to support an inclusive environment? And how can we create a culture of inclusion and equity demonstrated in our daily actions and words? And so this toolkit pulls a lot of resources to help answer some of those questions, but also it synthesizes some of the best practices that came out of that learning collaborative. can you go to the next slide, Emily? So the toolkit itself is broken up into different sections. It first includes a few racial equity organizational assessments, and there are many already out there. We didn't feel like we needed to recreate an organizational assessment, but we did want to review them and curate them to find ones that were really good, really well put together, and that would apply to a health center setting. So there are 3 options that we share just in that toolkit. We also share examples of inclusive practices that were identified in the Learning Collaborative. And then we also share health center profiles so that you can see what other health centers are doing, from their equity statements down to how they staff equity and inclusion at their organizations. We also have some self-reflection questions around cultural humility that we think are really good for teams to reflect on. We have tips and a resource for leader and board accountability, and then just additional workforce resources. And so I'm going to share my screen so that I can show you what this toolkit looks like. So I want to show you some different components of it. So the toolkit, I'm going to skip through the about this toolkit because you heard me talk a little bit about that. But we start with this important statement that is diversity is essential, but not the goal. And I want to point out the sentence that says a fully representative workforce is essential. That does not necessarily mean staff of marginalized identities feel safe, heard, or respected, that your clients benefit from that diversity, or that your policies and procedures are just. So I think that's really important, because one of the issues that we hear about most is that, yes, organizations are on board for diversity, equity, inclusion, but they stop after the diversity piece of it, and then they don't really know how to be inclusive. And a lot of that is because change is hard, and hearing that certain policies or practices aren't inclusive is hard. There's a lot of shame that comes with that. But to be inclusive, we need to create space for that dialogue. So we include definitions just for those who are just starting to think about this work and wanting to dig into it a little bit deeper. How is diversity different from equity? How is equity different from inclusion? And so you'll see parts of equity and inclusion initiatives buried into this document, and I'll go through some of those. So the first part of it is the racial equity organizational assessments that I mentioned. So there are 3 that we really liked. These are by Just Lead Washington, the Coalition of Communities of Color, and All Hands Race, developed one collaboratively, and Race Forward. And I want to show you what these look like. So this is an example from the one that Just Lead Washington put together. This is the recruiting, hiring, and retaining a diverse workforce section. There are multiple sections of this. And what I like about it is that you can answer a question and identify a rating. And based on where you are, you can use that for planning and then come back a year later. And if your ratings haven't changed or budged, then you know that you haven't done enough to really support diversity, equity, and inclusion in your organization. So these are not only nice ways to benchmark and identify where you need to go and how you can grow and whether or not you're growing, but it's also just like a checklist of things that we need to be doing in our organization that we may or may not be doing, or we may be able to do better. So definitely wanted to make sure you guys had access to that. The next thing I want to point out is that we have a section on implementing inclusive policies. And so these are some of the things that our health centers that participated in our Learning Collaborative did. And these are health centers that were doing just a really great job. So one is developing a mission or vision statement around diversity, equity, and inclusion. This is different than your equal opportunity statement. This is something that you can put in your job announcements to let people know we really do value everybody with different identities, and we want to include those identities in our work. And so that is going to be a real big draw. Put it on your website as well. Organizations that are doing this really well often have a task force to lead diversity, equity, and inclusion work. So you want to make sure you have leadership around this. And this also creates this intentional space for these conversations to happen, and then also some accountability. But you want to make sure that the folks who are participating in your task force, their recommendations are heard and valued among your leadership. you want to integrate diversity, equity, and inclusion into professional development. So often people are scared to have these conversations, one, because they don't know the correct terminology. People feel like they're going to get called out or shamed. Often trainings might be centered on the white voice. So you want to make sure that people get that foundational training on how to engage in these conversations so that everybody feels comfortable. People know how to point out something that made them feel uncomfortable in a way that continues to engage others in conversation. So definitely include that in your professional development, and then continue to include more advanced trainings and offer those to your staff. And some people will, or some organizations will have sections in their performance evaluations on what are you doing to increase your diversity, equity, and inclusion awareness. And so these can be some things that staff are basically receiving an incentive for participating in these in terms of their professional development. And then offering or establishing affinity groups, and there's a link in here that's a really good article on how to establish affinity groups for people to come together, talk about their shared experiences, receive support, and then discuss opportunities to address workforce challenges and needs. And so that's just a really good way to say, you know what, it seems like several of us are having a similar experience. Let's get together and think about a way that we can bring this to leadership and make some movement in terms of changing this experience. We have some additional strategies. And like Mason said, definitely review your position descriptions with an equity and inclusion lens. Look for gendered language. Look for any language that is going to really encourage people from different racial and ethnic groups to want to apply. So for example, if you have any programming that's really tailored to people who come from different cultures and identities, then make sure you call those out in your application or in your job announcement. Definitely working on practices to mitigate bias in hiring. There's a link on that. And then we have mentorship programs, which Mason also mentioned, and that goes into the equity piece. Also, it goes into what Emily was saying in terms of not everybody has had the same opportunities for training and educational advancement. And so in terms of our equity practices, a lot of health centers are starting to have mentorship programs for people who have identities that are marginally from marginalized communities. So that's a really good opportunity to promote advancement within the organization. So it's in the hiring practices section, but it's really to say, you know what, let's hire from people you already have and see if we can advance them within the organization. And I put a note in here to see Kaylin Lord's Community Health Center profile. There's a link, and if you go in, I encourage you to look at it. And they were such a great health center to talk to about this, just because they were talking about their mentorship programs that they have in place and wanting to advance and promote more marginalized populations into director and leadership positions. But what they were finding is that they weren't setting people up for success because they weren't providing them with those leadership trainings. And so they decided to put into place this mentorship program that's a two-way learning opportunity between the staff person who is seeking that professional growth, as well as the leader who's paired up with that staff person to learn more about how their culture and lived experience benefits the organization. And so in the next section, you see that the 2 health center profiles that we include in this toolkit is from Kaylin Lord Community Health Center. I included their DEI Anti-Racism Committee's working vision statement. It's really good working statement. And then Central City Concerns equity statement. I'm going to show you a example of the profile. So in this, you can see with Central City Concern, the timeline of their work. So you can see it took several years to get to where they are now because they have a pretty extensive equity and inclusion department or governance. And you can see that now what it looks like is it goes from a diversity steering committee who's planning staff events and resource guides and 101 and 102 trainings, and then they have work groups that really focuses in on their equity and inclusion roadmap and different staff resources, the LGBTQIA+ work group, as well as a equity, inclusion, and trauma-informed care review board. And then they have specific staff who are hired to lead this work. And you can see who those staff are. And that goes all the way up to the Chief Equity Officer who participates in the Executive Leadership Committee. So a lot of intention and finances, frankly, were put behind their equity and inclusion work. And that's something that we all need to remember, is that if you're going to really be intentional about this work, you need to put a budget behind it. So I am going to go back up real quick because I missed something. In the hiring practices, I wanted to point out that we do have a job postings list. And this is an example of that list. And what we have is just an example of different groups that have career boards that you might want to consider posting your job announcement on. And this is really important because a lot of times we hear health centers say, you know, we just aren't getting people from different groups applying for our jobs. And there might be a reason for that, and it's because you haven't changed your recruitment practices to make them more inclusive. So make sure that you're looking at different places that you can be posting your jobs, and what in there is going to attract candidates from different racial, ethnic, and other marginalized identities. And I'm going to go back down. Here is where we're talking a little bit more about how we can create a culture of inclusion, demonstrating our daily actions and words. We go into cultural humility, which I won't talk too much about because Emily and Mason already did. But you can see in this blue box that there are some really good reflective questions that you can ask yourself about whether or not you're really practicing cultural humility. And I think it's also a really good set of questions to bring up at a staff meeting if you want to talk about how your staff is being culturally humble. It's just a really good way to reflect and identify where you might be able to grow. So just the final part of this toolkit is just showing, making sure that the data you're using is basically being used to make your organization accountable for diversity, equity, and inclusion. So what you want to do is conduct an assessment, use one of those racial equity assessment tools, share your results with your leadership, with your board of directors, ask that diversity, equity, and inclusion be part of quarterly board of director meetings, and that they are basically kept aware of any progress and needs in these areas. And then for those of you who might need a little bit more help in, or if you think your board members need a little bit more support in being part of this work, ProInspire has a really cool resource called Crisis as a Catalyst, a call for race equity and inclusive leadership. That's got some really good pointers for leadership and board of directors in trying to create change within their organizations. And then we also have several other resources that we thought were just really good resources for folks who were trying to do this work, including equity and social justice strategic plan, racial equity tools, bias interrupters. So there's a lot of different resources here that we encourage you to tap into as you're doing this work. And so I'm going to stop sharing and hand it back over to Emily.
All right, thank you. All of our resource sharers, these are amazing resources for all of us. Again, you know, the driving point here is that you don't have to reinvent the wheel. I know I skipped to the third key takeaway here, but we don't have to reinvent the wheel. There are these resources available to us to hopefully tap into. And not only are the resources available, but these faculty, myself, we're all available to provide that training, technical assistance, and support, and just sort of workshop and brainstorm some of these questions for you. So just some key takeaways for today. You know, we went over and discussed that, you know, a diverse workforce really optimizes patient care and bolsters staff retention and satisfaction. But, you know, as Linda pointed out in the Q&A, just having a diverse workforce for having a diverse workforce sake is not enough, right? We have to make sure that the workforce really is included and meaningfully integrated and respected and valued, and that equity really is the heartbeat of our organization. And we also want to just share again that building an inclusive workforce is not a top-down effort. that starts from the top and, is sort of dictated down. It really does require input and participation from all staff. And that is sort of the beginning of making sure that folks at all levels of staff, whether they have lived experiences with patients or not, really feel that their role is valued. So we want to share our contact information here. All of us are available to be contacted with any questions at any time. I shouldn't say any time, but really, please feel free to reach out to us if you want to explore any of these issues further. At this point, it is the top of the next hour, so we're going to conclude our sort of formal presentation. But now several of the faculty are going to stay on the line today and be available for a more informal sort of office hours for you all. So at this point, we can open up some of the phone lines if you'd like to raise a question or just comment or just share amongst each other or with us. You're really welcome to do that. This time is for you to kind of get the most out of this and to explore some of these ideas. So quickly before we do that though, wanted to just shout out our fellow partners on the SDOH Academy. Many of these logos will be familiar to all of you, but all of these National Training and Technical Assistance partners are part of the SDOH Academy with the faculty today. So we are now into office hours. I want to thank everyone who has to jump off. I totally understand if you have to go to your next meeting at 4 p.m. Eastern or whatever your time zone is. But for those who are staying, we would love to just open the lineup. I'm actually going to stop sharing the screen since we don't need our office hour screen up, and ask that the faculty who are able to stay can share their videos. Great, thank you, faculty. So at this point, I'm going to go ahead and encourage you to raise your hand if you would like to be unmuted, or otherwise in the chat, share any questions or comments with our faculty. While you all are thinking about that and doing that, I have some questions specifically for Virginia. I know Mason had shared the resource with everybody, but I wonder if you could provide the links. I know he said that there were chambers of commerce, the National Chamber of Commerce, the LGBTQI plus Chamber of Commerce. I wonder if you could share some of those links or resources, or just other places, like similar to what Sabrina was saying, other places where health centers could post job postings and things to recruit individuals with those backgrounds.
Sure, I'd be happy to do that. I'll take a few minutes and pop those in the chat for everyone.
Okay, thanks so much. All right, please go ahead and again, raise your hand or type your chat questions, comments in as folks are doing that. Any speakers, any other things you'd like to share to make sure we don't forget to go over? I did want to share, just in case folks aren't aware, that the organizational assessment, I think that Sabrina, you had shared in your resource, that is a really great place to level set. Even if you feel like your organization, your health center is doing, a great job and is really valuing, incorporating folks with lived experience into your workforce. I do think that a periodic organizational assessment like that, the one that Sabrina shared, would be a really great level set, especially if folks are just coming into the organization and want to get a sense of what the organization values and what's the history, right? So I just would love to, Sabrina, did you highlight any health centers in there who shared that they did that assessment?
No, I didn't do that. And I'm actually not quite sure because I'm not tracking that, which health centers might have completed this assessment. But yeah, I agree with you. Those are a really good place to kind of see where you are now and see where you need to grow. I will say too, that there are other resources out there that I really like and that other organizations have found to be really eye-opening. One is basically a list of organizational traits that are rooted in white supremacy. a lot of times we don't know because we're so in it and embedded in it. We don't know that those traits or those characteristics are embedded in white supremacy. So for example, the idea of urgency and the idea of perfectionism. And it's just really eye-opening to read about that. And there are multiple experts who have podcasts and other resources that talk a little bit more about that. But that's something that I personally have found very opening. I've struggled with myself is perfectionism. And also, you know, in a nonprofit, sometimes there are so many deadline-driven efforts that it's hard not to be in a state of urgency, but we have to think about how these types of behaviors and characteristics harm other people who are expected to carry that for your organization or carry those expectations that you have based on your own privileged training and education.
Yeah, I love that. Thank you, Sabrina. Yeah, I think sometimes it's hard to find assessments that are going to be appropriate because there's so many out there. And I feel like that is a really good place to start if you want to just have something that really gets to the heart of what is going on, which is a lot of the times that sort of the effects that white supremacy can have on access to healthcare and how some folks aren't able to enter the healthcare workforce. So thanks for sharing that. Any questions or just comments, concerns that you'd like to share with our staff? Again, we're here just to be facilitators for you and sort of answer any questions. For Emily, how does someone get the training to ask the SDOH questions in a practice? Maybe an MA in a practice was given the task to ask patients, sensitivity training especially. Hope I asked that correctly. Yes, I think that's a great question. So the webinar that the faculty did last week was really about screening and some of the nuances that go into that, including using the Prepare tool. And so there are a lot of SDOH screeners out there. You don't have to use Prepare, but one of the sort of good things about using tools like Prepare and other evidence-based tools is that they have some support that go along with it, including guides and resources about how to use those tools, how to ask those questions. So I know that Prepare was developed by APCHO and NAC, who are fellow NTAPs, and they are very, very willing and excited to share some resources around that particular question. How do you ask these questions? How do you phrase this, right? One of the things that I think would be critical, in addition to selecting a screening tool with resources like that, though, is to maybe think about opening up training around motivational interviewing for your staff, or training around empathy, right? And sort of that sanctuary model of care where you're really, you're asking questions and reflecting back to folks. So I think we can think about specific like techniques like motivational interviewing that might be helpful while picking a tool that also will be the right fit, you know, for your health center. So I'm happy to share, I'll share in the chat some resources around motivational interviewing and around Prepare and things like that. And again, I encourage you to look at the SDOH Academy website for the recording from last week. The faculty on that webinar from last week really dove into screening, and they talked about some of the challenges and suggestions and things that go along with that. So you're welcome to reach out to them, of course. Any other faculty have responses to this question? So about training to ask those questions.
In the community health worker tool from the National Healthcare for the Homeless Council, we also talk about trauma informed, because asking those questions, you also want to make sure that you're asking in a trauma informed way, so that you're not re-triggering or re-traumatizing individuals. So there are resources in there in that module. Actually, it's the core competency. I'm sorry, I keep saying module, but it's actually section 4, where it does some training around trauma informed, as well as motivational interviewing and some other skills. So if you look in that tool, that guide from the Healthcare for the Homeless, you will find some resources there as well.
Yes, and we do quite a lot of work around the asking of sexual orientation and gender identity questions, or SOGI data, which can form part of what provides context to understanding some social determinants of health. And so there are a lot of resources on our website, and we're also happy to help with any technical assistance questions related to how to frame those questions. We have even videos showing experiences of staff asking questions. So, so that would be a great place to find examples as well.
Yeah, I think the idea of like showing videos of examples of like how to ask these questions, even if your own staff or leaders like filmed yourselves like asking questions and role playing, like those role playing activities, I think can be really, really helpful, especially if you're starting to implement something like that, so that people really can see. Because some of your staff, like you might give them a list of questions and tell them, here's how you should ask them. But, you know, a lot of us are visual learners, or a lot of us learn from experiences. And so it might be really nice to have that compendium of videos or something and say, here's like an example, right? Here's how we might ask this question. And just, I think having resources like that can be really nice. I know there's a couple on YouTube, but Virginia, to your point, I think just like tangible tools like that are really a great thing for your staff to have. So yeah, the answer would be, I think, trauma-informed lens, motivational interviewing, but definitely picking a tool that's going to make sense for your organization. And prepare. The good thing about prepare in any of these tools is that you can adapt it. It's not like you have to use exactly the tool that's created. You can add or change questions depending on your needs. So I think that's another thing to just kind of think about. I also wanted to share, so one of the practices that we work really closely with in Philadelphia uses the sanctuary model of care. But it's also, the sanctuary model sort of extends to staff as well. And I know that they had a lot of resources that, Darlene, to your point around like trauma-informed care, a trauma-informed workplace. And I'll share sort of information about the sanctuary model. It's, you know, definitely something to think about. Not, you know, for sure, definitely something you don't have to pursue, but I know that there's a health center, particularly one in Philadelphia that we work with, who really found that adopting the sanctuary model kind of opened up the staff to really build that culture of trust and feel comfortable in asking those questions and sharing their own experiences. So just something to think about. Question came in that Sabrina shared. Can you talk more about working with clinics to allow more individuals to access the EMR? That's a big challenge. Yeah, and I don't really have necessarily the answer to that. I would actually really love to hear from either fellow health centers or the faculty on here. But the question is talking about allowing more individuals in the health center. And this is the question that I hope I'm getting it right. More individuals in the health center to access the EMR and hopefully input information into the EMR. So it seems like maybe the struggle is that, for example, if a CHW is asking questions around social determinants of health, but they aren't able to access a patient chart, or they're not, either EMR access is limited in some way, then like, how is that information getting into the system, or how are they getting information from the system? So does anyone have any thoughts around that? I would love to hear from fellow health centers, but if any of our faculty have some ideas, that would be great too.
Sure. So Fenway Health, we're also a health center. So the National LGBTQI+ Health Education Center is within Fenway Health. And, you know, I think in the experience of EMR systems, certainly, sometimes it depends on the system you're working with, but sometimes there's the ability to advocate for certain types of permissions for staff. So that might be a question for leadership, a question for a larger discussion around how can you advocate with your EMR provider to help you create systems of read-only access if needed, or read and you know, input only data access. And I'm just thinking of specific EMR systems that I've worked with, like Epic, for example, has those abilities. So just working with the Epic provider and finding out how to create that system that works for you may be an option.
Thank you for sharing that, Virginia. And thank you for sharing, Darlene, another resource, trauma informed. And so this is sort of we have a wealth of resources, which I think can also be overwhelming sometimes to have so many different things to look at. So if there ever is a question where you're just not sure what exactly to look for, or you don't really, you know, you're trying to find a specific resource, but then there's a bunch that come up. I do know that many of us, well, actually all of us, all faculty on the call, contribute to the Health Center Resource Clearinghouse, which is like basically a giant compendium online for resources around all of these different things, including SDOH. I know we are piloting, and someone, I should probably know this, but we are piloting a triage so you can enter in that you need support around a certain issue. And one of us essentially will like get back to you with the resource we recommend. Or just additional help. I know that we were piloting that and hopefully have that available soon. But basically, if you are just sort of like looking for something, you're not sure which one really fits the best, you want to make sure that it's correct. I do think that you can send that triage request, but it also might be forthcoming. So it's either available right now, or you will have access to it very soon. But I do know that we have it coming shortly. So, and then obviously in the meantime, our email addresses are available for you to make sure that that we point you in the right direction to the resource that you need. Oh, thank you, Stephanie.